Hello, my name is Anamaria Cozma-Petruț. Welcome to the first episode of FIP CPD Bites series on self-care approaches for fatty liver disease management. This episode will provide information on the definition of fatty liver disease, its pathophysiology, global prevalence, and the main risk groups and risk factors. In 2023, a multi-society Delphi consensus statement was released regarding the new terminology for fatty liver disease. The consensus introduced steatotic liver disease as an umbrella term that encompasses the spectrum of causes of hepatic steatosis identified by imaging or biopsy. As you may know, steatosis is the abnormal retention of fat within a cell or organ. Steatotic liver disease comprises several subcategories, depending on the potential etiological factors, and these include the important subcategory of metabolic dysfunction associated steatotic liver disease or MASLD, formerly known as non-alcoholic fatty liver disease or NAFLD. In the new nomenclature, the term MASH, formerly known as NASH, non-alcoholic steatohepatitis, characterizes MASLD accompanied by steatohepatitis. Currently, MASLD is counted among the most common causes of steatotic liver disease. MASLD encompasses individuals who have hepatic steatosis and have at least one of 5 cardiometabolic risk factors, which refer to the presence of overweight, obesity, or a large waist circumference, high blood glucose, high blood pressure, and abnormal blood levels of triglycerides and HDL cholesterol. MASLD is a multi-system disease where insulin resistance and related metabolic abnormalities play a pathogenic role in the development of MASLD and its most relevant hepatic and extrahepatic complications. If left untreated, MASLD may lead to cirrhosis, liver failure, and hepatocellular carcinoma. MASLD may also affect extrahepatic tissues, with cardiovascular disease being the leading cause of mortality in MASLD patients. Likewise, MASLD increases the risk of type 2 diabetes, chronic kidney disease, and various non-hepatic malignancies such as colon cancer. Currently, MASLD is an important public health problem, being the most common cause of chronic liver disease globally. Around 1/3 of the global population is affected by MASLD. The disease is most prevalent in Latin America, the Middle East, and North Africa. But even so, it also affects large proportions of people in other areas of the world. About 20 to 30% of patients with MASLD go on to develop MASH, and recent data indicates that MASH is the most rapidly increasing indication for liver transplantation in the United States. In Europe, liver disease is currently the second leading cause of death for people in their working years. And the global prevalence of MASLD is predicted to increase further within the next decade, along with the growing worldwide epidemics of obesity and type 2 diabetes. Therefore, effective interventions are urgently needed to target MASLD prevention, early detection, and management. Current treatment recommendations for MASLD focus on lifestyle changes. Moreover, several national practice guidelines recommend the use of hepatoprotective agents as a supportive treatment in MASLD. MASLD tends to be more prevalent in males than females, but MASH seems more prevalent in postmenopausal females. And although MASLD prevalence increases with age, it can affect individuals of all ages, including children and young adults, a phenomenon related to the growing epidemics of obesity and type 2 diabetes among youth. Likewise, some individuals may be genetically predisposed to developing muscle, as several genes such as the PMPLA3 gene can influence the risk of muscle. Furthermore, excess caloric intake, excess saturated fat and fructose intake, sedentary behaviors, and smoking increase the risk for muscle. All these unhealthy lifestyle choices can further lead to metabolic abnormalities. And muscle is mainly driven by metabolic disorders. Features of the metabolic syndrome are not only highly prevalent in individuals with muscle, but they also increase the risk of developing muscle. Thus, muscle is more likely to occur in people who have excess adiposity, especially abdominal obesity, impaired glucose metabolism, high blood pressure, and dyslipidemia, such as high triglycerides and low HDL cholesterol levels. Indeed, available data shows that the prevalence of muscle is 70 to 75% in individuals with overweight and obesity, and around 56% among patients with type 2 diabetes mellitus. Some key takeaways are that muscle is a common and rapidly expanding disease globally, contributing to a significant public health burden. Muscle is a complex multi-system disease that may lead to hepatic and extrahepatic complications if left untreated. Effective interventions are urgently needed to target muscle prevention, early detection, and management. Besides lifestyle changes, hepatoprotective agents are recommended as part of the treatment by several muscle treatment guidelines. And this topic will be explored in more depth in subsequent CPD Bites episodes.